Hi everyone, and welcome back to the next session. It gives me great pleasure to present Kristi from Optum. We'll be having a fireside chat and talking around the US payer perspective on telemedicine. So Kristi, welcome first of all.
Thank you. I'm glad to be here.
Well, glad to have you here. Just sort of kicking off, I mean, I guess to start before I've got a couple of questions here for you. For anyone who doesn't know sort of, who you are, who Optum are, just can you give me a very brief overview of obviously yourself and the company?
Yeah, absolutely. So I'm Kristi Henderson. I am leading the Telehealth and Innovation arm of Optum Health. And Optum Health is a part of United Health Group. And so the umbrella is United Health Group. Within there is the payer side, United Healthcare, and then Optum Health. And Optum Health has care delivery organizations, our Optum Insights division, Optum Pharmacy. And so it is a network of care delivery organizations and the largest provider network for primary care in the United States.
Fantastic. So I guess to start then, obviously, by the sounds of it, digital innovation is, it's very much, of the moment, especially given everything that's sort of been going on. Which applications do you see as sort of key for the US health insurance and healthcare market at the moment?
Yeah, we learned a whole lot during the pandemic, and we're still learning a whole lot about the application of digital health. Every other industry is so much further along, and I think that the trusted relationships that we have between patients, members, and their clinicians is incredibly important. And typically that has been preserved with in-person relationships. And there was a lot of myths and even uncertainty and skepticism around how digital health would play a role. And I think that's why you've seen this slow movement and adoption of it. Not to mention some of the barriers, and I think we'll touch on those a little bit later in our discussion. But we have an amazing opportunity, and during the pandemic, the silver lining of this is that everyone got to try digital health, just like we're having conferences now virtually. We all got thrown into the deep end. And during that, we learned a whole lot around the possibilities and really busted some of the myths that existed around the use of digital health. So I'm incredibly excited about this movement forward to a more permanent state of integrated use of digital health tools in the healthcare delivery system, as well as in the payer side of this. So, when I think about things that I'm most excited about, I've been in telehealth and using these types of tools for many decades, started working in this space in 1999. So I tend to think of the video visits and telemedicine and telehealth as really table stakes. So, for those that are still moving in that direction and slowly adopting that and thinking about how to use it for all types of clinical use cases, as well as all age groups, I'd say keep pushing on, because I think that's table stakes. But there are some really exciting things that I think will play a really important role in helping us deliver on lower cost quality care that's accessible and convenient for members and patients. And so one of those is precision navigation tools that are really about matching and routing people to the right care provider at the right time in the right setting. And so not everything is appropriate for virtual care. Some things need in-person care. But what we want to do is take friction out of that decision point and use precision navigation tools that can match people appropriately to the right side of care with the right provider as well. So that'll help with a lot of different things. One, just making it more hassle-free, but more importantly, using the limited resources that we have in the healthcare delivery system in the right way. The other area is asynchronous care, which is kind of a feed off of exactly what I closed on with precision tools. We've got to really think about convenience as well as our supply and demand matching. And so when you think about asynchronous care, individuals and members want to just get things taken care of when they want to get it taken care of. But we've got to match that with the availability of clinical resources. So asynchronous care just allows us to do that at scale more effectively and efficiently. So tools that allow you to give your history, send images, and get interactions on each person's own time. And when they have availability, allows us to do a lot more with less. Clinical decision support tools with augmented intelligence is another area that I'm incredibly excited about, really helping us from a member or patient perspective understand what's the next best step that I should take as a patient. Should I go to the clinic? Should I go here to the hospital? Whatever it may be, guiding people and helping take those decision points out of the equation. From the provider, what are the things that I need to do for this individual? If I'm managing thousands of patients within a panel, keeping that all organized to understand what test needs to be done when, to make sure we're working in a health and wellness and prevention side of this, and not always just a reactive sick care. And a lot of progress has been made there. Our health system has something called optimal care that is really helping guide next best action for our clinicians. So those are three main areas: precision navigation, asynchronous care, and clinical decision support with artificial intelligence, that I think is really exciting.
Yeah, definitely. I mean, you've touched upon it there. I mean, lots of information to digest, and obviously the pandemic has seen, so many different companies and so many different partnerships sort of, accelerate and come together. What sort of cross-sector partnership models do you see emerging? I mean, or are seeing emerging at the moment?
Yeah, well, so this is hard. Healthcare is not easy. And if you look at the determinants of an individual's health, it's not just around sick care and what happens within a clinic. It is much broader than that. And so these partnerships around healthy communities are really emerging in ways that has public and private partnerships that are helping to drive those results. So I see that with healthcare organizations, insurance companies partnering with retail, technology vendors, telehealth companies, community partners around transportation, helping people to get to and from appointments and getting what they need, surgery centers, really just everything, lab and pharmacy. Amazing partnerships at the local level that are really creating these health hubs so that people can take advantage of all the different services that they need to really get healthy.
Perfect. Yeah, I mean, definitely lots of opportunities there. And obviously, in the last 12 months, the events that have taken place, it's hugely accelerated adoption of various digital technologies. I mean, perhaps no more so than with telemedicine. So how did you and sort of Optum approach this? Where are you now? How's it been going? Sort of tell us a bit about that.
Yeah, so when the pandemic hit, just like everyone, we really had to create a digital response team to do nothing but provide access to the same services people had been getting in person through digital means. And before the pandemic, we really did not have a large digital health presence at all. So we jumped in and had to deploy tools to our provider network across Optum Health in a way that none of us had ever imagined we could do as fast as we did. And so we had about a 50-fold increase in telehealth use since April. And that means that in the prior year, we had less than 1,000 telehealth visits in that from our providers within Optum Health or Optum Care. And since April through the end of the year, we had just around 1.3 million telehealth visits. And so that's a 50-fold increase. And that was using about 17,500 providers were given the tools. And we just jumped in. And that meant we had to educate the public and their patients. We had to change how the entire operations of clinics occurred. So when we deployed those tools, we were just trying to take care of annual wellness visits and sick care and all of those things that really pushed our understanding of how we could use it. And it really also magnified our continued opportunity to advance the use of digital health tools. I mentioned before, it really gave us a chance to have our eyes opened. And so some of those biggest skeptics realized, wait, you actually can use these tools and do an annual wellness visit for a senior that you're taking care of. You could do a pediatric annual wellness visit. And so I think many people had a perception of telehealth around just coughs, colds, and minor illness for urgent care. And we really saw quite the opposite, with the majority of those visits that I mentioned being in the over 55 population. And so really had an opportunity to understand where to use it, where to keep building it out. So we deployed lots of tools all over the entire country. We went on a campaign to make sure people got the care they needed. And so there was all of those telehealth visits, but we also realized that not everybody had the technology that they needed to be able to connect. So we also had to create a logistics arm to be able to ship devices to people. And then in turn, we also created curbside care, where you would drive to the clinic, we would bring the technology out to you, and you were still connecting to your provider. But that addressed some of those things around not everyone has access to broadband. Not everybody has a smartphone that allows them to do this. So we really just were solving problems. This is where real innovation happens, and we responded in an amazing way. So a huge growth that I anticipate will continue to stabilize and be more of a permanent fixture within our healthcare delivery model. Over 50% of our behavioral health services from a payer side, insurance side, were telebehavioral, meaning they were delivered through telehealth, 50%. So that was a complete conversion of our traditional behavioral health program within the payer side. So exciting times. We learned a lot. The whole country, the whole world responded in an amazing way to be able to address the health needs of individuals. So the silver lining is that we'll have a more mature telehealth delivery network as a result of it.
Fantastic. I mean, lots of changes, as you said, and I mean, you touched upon some of the challenges, and not everyone having, obviously the technology required for this, new innovation within telemedicine.
Yeah.
I mean, what do you see as the biggest challenge in a move to, non-physical clinical care through telemedicine?
Yeah, the reason it was so nascent before the pandemic is because of those barriers. So some of it was just a skepticism. It's always hard to change. Nobody wants to change, right? It has to solve a problem for both individuals as well as the clinical team, or you get friction on one side and it just doesn't move forward. But the ones you always hear of everyone talk about within the US health system is around, regulatory, for example, sites of care, and the payment policies didn't match to allow us to have our providers and our clinical teams reimbursed for those services if they weren't delivered by a specific type of healthcare provider in a designated reimbursable approved site of care. So when we move it into the home, and then we start having our broader healthcare team supporting the care needs of patients, those aren't reimbursable. So there was huge friction before, and it varies by state as well. So it was just too confusing and complicated for people to be able to understand it and operationalize it and scale it. So the regulatory pieces continue to be a barrier up until the pandemic, when waivers were deployed. So waivers around site of care, type of providers delivering care, as well as even cross-state practice. And so those need to become more permanent, or need to become permanent if we're going to really maintain the progress that we made in a digitally enabled healthcare ecosystem. While those are just a few of the ones, we've still got other things around interoperability and data sharing and things like that are going to be important and continue to be challenges that we'll have to push on. But I'll tell you one those are regulatory and policy changes that need to occur to be able to help enable that. The workflow piece of this is really one that needs to be emphasized. And so when clinics closed and we moved to telehealth, it was not too hard to say, hey, click here and you'll see your doctor. But when we try to merge in-person and telehealth with the same healthcare provider team that's managing people walking into the clinic as well as dropping in virtually into the clinic, we've just got to change operations, and that there's still a lot of work to be done to have the two integrate fully and maximize both in the way that results in the right outcomes. And so I anticipate, like we're already seeing, as soon as clinics started reopening, we are going back very quickly to our old models. And so that right balance between virtual and physical is going to be an ongoing challenge until we get the operations and the full integration of the technology.
Yeah, it sounds as though there's also sort of a challenge in terms of sort of changing the mindset as well. Obviously, as you say, moving from the old to the new. So, I mean, how have you been working, to demonstrate the value of digital to patients, clinicians, health systems, communities in general, really?
Yeah, so there's an enormous amount of literature out there that shows the impact and value of telehealth, but that's been there. And there's just as much that shows it is great and effective as there is that shows that there's still challenges and potentially it's not as much of a rose garden as we would want. But what our we did, at least during this time, is to take that enormous growth of 1.3 million telehealth visits and to start analyzing. And we're still in the process of that, but to dig in there and understand what actually did occur, what types of care was provided, were we able to fully manage the needs of the individual in a virtual environment, and then looking at the total cost of care as well. So cost, convenience, member or patient loyalty, did they like it, and their satisfaction, the experience, and then the clinicians as well. And what we're finding is not only did the clinicians like it and see great value, and if you think about the burnout that's plaguing our healthcare professional environment, we've really got to think about ways to bring joy and delight back into their profession and take away some of the administrative burden. And so many are seeing that as a win. So we're showing value to our clinical team, we're showing value to patients based on their really rave reviews of being able to be seen in that environment. But we're also making sure that we're looking at the quality, and what we're learning from all of that is there is value and that it does make sense for us to do that. But now we're going to be able to take those learnings and build it into a knowledge base for our precision tools that I was mentioning at the beginning, to be able to make sure that we're driving people in the right way to the right types of care, and then also considering an individual's preference. Where do I want to be seen as well? So all of those things are helping us to not only show the value, but think smart about what a connected health ecosystem looks like on the other side.
Perfect. And one last question then, because we're getting towards the end of the session that we have, but you mentioned sort of the precision tools, and obviously you need tools in order to make all of these exciting things happen. So for you, what are some of the most exciting digital tools that you see as the ones that are really going to make the biggest difference at the moment? And how would you expect to make the biggest impact using these going forwards?
Yeah, so I think that you've heard some of them as an undercurrent, and when I get excited about where we're going, but asynchronous care with artificial intelligence, I think, is really going to be a game changer when we think about the challenges in supply and demand around patient preference and experience expectations. I want it when I want it mentality, but we can really do that in a smart way to allow healthcare providers with limited resources to be able to match the needs of the customer. So super excited about where asynchronous care can go. And that's that's because we've had great advancements in our augmented intelligence and our algorithms associated with that. And as we have a continuous learning loop from all this data that we have, it'll get smarter and smarter and help us to think about when do we really need face-to-face care, and when can asynchronous work. So that's going to be really exciting area. The other is around the technology advancements in diagnostics, vital sign collection, and remote physical exams. So if we're having just an audio and visual interaction like we are right now, there's only so much that you can do, but with connected devices, wearables and sensors and ingestibles and dissolvables and all of the things that are happening in that space, being able to collect additional data points to make sure we have all the information that we need to appropriately diagnose and treat individuals is really exciting. And I'll tell you, it's going in another direction to where it's not even going to require a wearable or a sensor, but that we will have, well, I should say it is a sensor, your camera being able to really start doing more of the diagnostic collection. So not having to have a separate device, but having the video interaction, even your earbuds on how they can even pick up and auscultate lung sounds. There's just some really incredible things going on in that space. So I think from the asynchronous care, some technology advancements around vital sign lab diagnostic diagnostic information data collection is incredibly important. And then lastly, I mentioned this one a whole lot, but the data insights to really drive the decisions that we're making and route people appropriately is going to be really powerful over the coming years. So I'm really, really optimistic about this full integration of virtual technology advancements, data insights into a much smarter healthcare delivery organization in the future.
Amazing. I mean, it sounds as though sort of the future is already here, and there's certainly lots of exciting things on the horizon. That's unfortunately all we've got time for. Thank you so much for being with us today and giving us not only your perspective, but sort of insight into sort of telemedicine over in the US. I think everyone will agree it's been a really insightful session. If anyone wants to connect with Kristi, please do so. Obviously, you know, over the platform, you know, this is what we're obviously trying to do is to create the life sciences community and sort of develop that through networking today. So thank you once again, Kristi, and I look forward to seeing everyone back here at 12 o'clock for another fireside chat with Novartis giving sort of their perspective around healthcare delivery across the globe and at a global scale. So thank you so much, and I'll see you then soon.